Welcome guys, I'm Stuart Hinds. We're here at Barwon Soft Tissue Therapies. We're in the engine room. I'm here with the lovely Emma Matthews, myotherapist. We're going to be talking all things soft tissue treatment for the plantar fascia, all coming up in this video. Okay, so let's get into it. Okay, we're talking plantar fascia today, and look, for any soft tissue therapist that's probably dealing with either runners, and not even runners, I mean just jumping athletes in general as well. Most of those are all prevalent to what I call sports-induced plantar fascia, and that's what we're going to be talking about. There are a lot of people that will come into your clinic with just no idiopathic or an idiopathic sort of plantar fascia, meaning we have no idea why they've developed this condition. But from an exercise-induced one, there's a couple of muscles that are really important. So I know there's a lot of value placed on the gastrosoleus that comes down through here, but today we're going to explore a couple of other really important muscles that you don't see, and that's your deep toe flexors. And I classify them as Tom, Dick and Harry. So the first one's going to be your tibialis posterior, your flexor digitorum longus, and then obviously your flexor hallucis longus as well. And they are coined as Tom, Dick and Harry because they all pretty well much do the same movements. Okay, so they're involved in plantar flexion and obviously inversion. Tib post is probably the most powerful one. So from a soft tissue treatment point of view, this is a really important muscle because as we come down into heel strike and then the foot comes down, we pronate. That pronation is where tibialis posterior comes up here and provides that stability and tends to hold the arch up for the foot. So obviously if that's not working well due to being overloaded, or obviously there's trigger points, then obviously we're going to have a little bit more of that pronation kicking in there. And then that spreads the forefoot, which means it also stretches all the tissue underneath. So you can understand why it's so important. So I'm going to explore the trigger point here in this deep compartment for tibialis posterior first on Emma, and she's had little or no work in this area, so this is going to be great. I'm going to be using the activate because I want to be able to sink into this tissue as much as I can. So if we were using the original, it's just got too much of a sticky consistency, so that's where the active comes in a ripper, either the active or the essential for that matter. So where we're looking at, here's your tibia along here, there's the bone there. If we roll off, then we're in that deep compartment there. If you want to find the trigger point, there's the condyle for the tibia there. If you come down about 2, maybe 3 finger widths, and then just sink into there, that's pretty much where the trigger point lies for tibialis posterior. And if you can see Emma's face, you'll know what I'm talking about. So just a bit of longitudinal gliding along the length of the tibia, the medial portion. So not on the tibia itself, but on that deep compartment through there, like so. Okay. Now, this is where the art comes into treating this trigger point, because I don't want you using your thumbs, okay? Shocking habit to get into, working into this deep compartment with your thumbs. So you're going to have to use a really broad pressure, not necessarily your elbow, but probably more that fleshy part just underneath here. I'm going to bring the table up because you don't want to be bending over too much. So here's that condyle here. We come down, so we're going to be in and around that area there. So the idea, come in, internally rotate, and then you just want to sink down gently to the point of resistance. So that's probably about as far as I can get there with them. If I try and push further, obviously she starts to contract and that's not ideal. So I back it off a little bit, come a little bit closer to the tibia and then sink in a bit more and hold that there. Now the trigger point for this tibialis posterior refers all the way down, basically into the back of the Achilles and then around and underneath the foot as well. So it can actually reproduce a lot of the plantar fascia symptoms. That's the goal of this muscle. So once again, coming down, sinking in. First point of resistance, which is about there, so I'll back off a bit there because I can tell by Emma's eyes. And it's a matter of just sitting here. So I'm not going to move in here and massage and try and smash away at this tissue, because obviously the idea is that Emma would start to contract against me, and then obviously we're just having a battle between who can get in deeper and who can push out, and I don't want that. So if this is the first time your clients are having any work in this deep compartment, then you just need to take time. Just let it sink in. Obviously the idea is to slowly and gently work in and not to force it. So it might be a bit of an unusual application for a lot of people, but you might be sitting here for a little while before you can actually get into the actual area itself, okay? And then obviously they may start to get that referral down into the foot or even into the back of the Achilles and so forth, okay? Once you've finished that, slowly come out, okay? And then you can go back into your longitudinal glides, okay? So I'm going to use a bit of a loose fist, and I'm going to use this part of my first finger coming down here. So I'm going to sink in once again to the first point of resistance, bring the leg out like so, and then I can start to just avert the foot and work through the tissue at the same time. Like so, all the way up. Funny enough, if you come up a little bit further, just a little bit more superior to tibialis posterior, you'll actually fall into the popliteus trigger point right there as well, which is really great for unlocking the knee when it strides. So that can also be a part of it. All right, so that's tibialis posterior. So we're working that long sling down here because obviously it comes along here and controls that foot as we heel strike into plantar pronation and then into supination. All right, guys. All right, guys, so we're into the second part of treating this plantar fascia. Now, as I mentioned to you beforehand, we have Tom, Dick and Harry, okay, when we're talking about our deep toe flexor. So we covered some tibialis posterior, which is Tom. This time we're going to talk a little bit about flexor dig longus, okay? So that's going to be Dick and the Tom, Dick and Harry. So almost identical, except it comes down a little bit lower than the tib post. It still does the same thing. It's evolved in plantar flexion, and obviously control a little bit does in that little inversion as well. So they're all on the same page, tib post being probably the more powerful, flexor dig coming in second, and then obviously that flexor hallucis longus. So this is almost going to be a bit of a mirror image, a bit of a repeat of what we've done. Still working in the medial compartment through here as well. So obviously we've had tib post up here with the trigger point. We come a couple of finger widths down and that will hit flexor dig. So it's going to be exactly the same sort of scenario, except the idea is that we're going to be just that little bit more inferior to the tib post. So if that's the case, what I tend to do, start off with some longitudinal glides like we did with tib post, so we can work just generally that whole medial compartment. You'll see here, I mean, obviously I can feel it, but this is our gastro and our obviously big bulk of our soleus down through here as well. So we're just going to nestle in between soleus, okay, push that out of the way a little bit, tuck in right next to that tibia, okay, the medial surface of the tibia, and then we just sink down into that there. Probably a little bit too much for him. No, maybe that's about okay. Is that right? Yeah. Like so. Okay. So this is going to be the area here for the trigger point for flexor dig. Okay. Now these muscles get missed all the time because everything's about been working that sort of gastrosoleus, which is still important, especially with plantar fascia. So if the bulk of the gastro and soleus is tight, especially soleus, you will definitely still get some issues with plantar fascia. So do not omit them out of your treatment plan. Okay, so now coming into flexor dig, as I said, here's the condyle. Down here, tibia condyle, right there. If we come a couple of finger widths down, there's going to be tib post. So if we come a finger width or more down there, then we're actually going to be in flexor dig, okay? And that's the trigger point for flexor dig. So we're just going to raise the table up a little bit so that I can sink into here. So we're going to be about this scenario there. Same situation. So there's the tibia, there's our gastrosoleus. So we want to sink into that little pocket, that little septum in there. Lock in. And I'll get Em just to push her big toe into my hand here. Yep, that's it, good, relax. So you should feel a little bit of contraction under there, and then I can just sink down into that That about enough, Em? Yep, no? Yep, that's okay there, yep. It's all right to have a voice, Em. So as I said, it's so important that you're getting your pressure right with your clients here. So if you're digging in too deep, they're just going to push you back out and you're not going to get the change and the effect that you want. So just take your time, sink in here, get some chat going with your client, take their mind off the situation, and you'll probably find that you can slowly just sink into that area there. Once again, the referral will go down along the length of the muscle itself. Okay, and then a little bit underneath the foot, and it can be sporadic where it refers to. So it can be into the heel itself, a little bit more in the forefoot, or spread throughout the foot itself. But because it's part of that Tom, Dick and Harry, so controlling that pronation on the foot after heel strike, that's the big important thing, because once you overpronate too much, and obviously we can debate till the cows come home how much that pronation is too much, that's when the forefoot starts to spread, and then all that tissue underneath gets spread and then gets stretched, and then you do that over and over again, and you start to get some inflammation of the plantar fascia onto the calcaneus. Okay, so we're really treating plantar fascia from more of trying to control that biomechanical overload. All right, I'm going to slowly come back out. That wasn't too bad, actually. Pretty good for someone who's not had much work in that deep compartment. So, same scenario again. We're going to follow up again. We're going to use this finger here. Snuggles right in behind the medial border of the tib. Bring the foot off so we can start to take it into a little bit of aversion. And just work really purposeful along that line. So this is more of a bit of a passive release technique. Okay, so just sliding along. Once again, checking in, making sure that the pressures are all right. They're not pushing you out. You'll know if you're too deep, because they'll push you back out, okay? So I don't want to see you working through there with your thumbs, okay? That's a bit ugly too, isn't it? Yeah. And for those of you that have ever had that medial compartment stripped out, you'll know exactly what I mean. So it's just a little bit more of a gentle approach, a little bit easier for our own hands and our own body, and also for our clients. All right, so that was Dick out of Tom, Dick and Harry for flexor digitorum longus. All right, so we're talking about treating flexor hallucis longus in our plantar fascia treatment. So we've got our Tom, Dick and Harry muscles. This is the Harry of the Tom, Dick and Harry. So we're looking at treating the lateral side of the leg here. So it is nestled right in here in this lateral area. So it comes down around here, sneaks around the calcaneus, underneath the foot, and then obviously inserts into the greater toe here. All right. So we're going to be working in this area here, and the trigger point is obviously going to be in and around here. Now the trigger point referral is obviously down into the foot as well, but the reason we're treating this, remember, is because of this whole biomechanical component, all right? So it helps support that medial arch. So we've got tib post, we've got flexor dig, and then also we've got flexor hallucis here as well. So it is to try and help support that muscle as it goes through pronation into supination, and then obviously off through the greater toe itself. So that's where flexor hallucis comes in a lot. So if you've got a lot of greater toe pain, then flexor hallucis can be a big part of that. And God forbid, if you've got toe pain and you're trying to obviously supinate out, then obviously that can change the biomechanics a little bit as well. All right, so we're going to come in here. As I said, we're in the lateral surface. So this time we're going to be nestling in behind the fibula, okay, as opposed to the tibia on the medial surface. Really, really easy. You're going to be aware that you've got your perineal muscles that run along here as well. So you've got longus, then you've got brevis, and then you've got that small one that sits in here, which is tertius as well. We're going to fall off that group of muscles, and we're going to be nestled just in through this area through here, okay? So it only inserts about this far up. So we haven't got a huge amount of area to work with. coupled with we've got soleus in here as well, okay? So it is a bit of a sneaky muscle to get to, but nonetheless, not a problem at all. So once again, I want you to stay away from using your thumbs as much as you can. I mean, I know you'll want to get in there and it makes obviously getting into it, so you can probably feel that I'm pushing into Emma there, and that's probably just a little bit too much, okay? So once again, we want to go along with a really broad approach if we can. So once again, I'm going to use just a little bit of longitudinal gliding, okay? So I just snuggle up right behind that fib, okay? Then I can slide right along the border of the fib, okay? And that allows me to get enough purchase into that flexor hallucis, like so, okay? Now, in order to get to the trigger point, you'll need to bring the foot out and over, okay? So I'm going to slightly just invert the foot, okay? Then I can come up, once again, not necessarily with the elbow, but the broad forearm. So I'm just going to push back and up into the fibula. So I'm coming around, push the soleus out of the way, and then I can sink in just in that area there. Can you feel that, Em? Yep. Okay. So you're sort of pushing soleus a little bit out of the way. At the same time, you're not resting on the perineals, but you're snug just behind that fib area there. And if you rock backwards and forwards, that should be pretty much flexor hallucis longus where we want to be, okay? And it will not be surprising if you get deep toe referral, okay? That way you'll know you're definitely on that flexor hallucis longus, okay? So I'm just sinking in, pushing up, and you sort of use the fib as a bit of biofeedback. If you're in the right area, about there, Em. If I rock backwards and forwards, yeah, you can start to feel it, okay? And as I said, it can refer into that deep toe, okay? So once again, it's just a sit and wait approach a little bit, okay? So we're waiting for our clients just to slowly soften. We take up the slack a little bit, go in a little bit deeper, and so on, as opposed to getting in there and just punishing that tissue, all right? So a little bit gentler approach for both and for all. And at the same time, you're saving your hands and your body, which is good for everyone. Makes the world go around and be a happy place. All right, so slowly coming it back out, like so. And then we can use the same approach like we did last time with Tom and Dick. We'll use the same with Harry. Once again, we're going to be using that part. Okay, I'm just going to roll in a little bit there. Okay. And then we're going to slowly slide up the lateral border of that fib. Sorry, medial border of that fib. And just working the length of it, like so. So it's fairly purposeful. And all the way like so. All right, so that makes up Tom, Dick and Harry. So obviously tibialis posterior, we've got our flexor dig long, and then obviously our flexus hallucis as well, which controls the greater toe. So just making sure that we get some control over that pronation component. And obviously if there is some sort of inhibition in that area or weakness, then obviously that's where those strengthening exercises can certainly help as well with plantar fascia, because you need all the help you can get when it gets to this plantar fascia. The problem is plantar fascia sort of gets into 3 different grades. So obviously you just get a little bit of pain when you stand up and walk around. It's not too bad. Then it progresses to, yep, you get a bit of pain when you walk up and walk around, and then it starts to linger on just a little bit longer, and then all of a sudden, before you know it, you're in a grade 3 where it's just pain all the time wherever you, as soon as you stand up and walk around all day, and that's a really nasty place to be. Especially not good for athletes who run. All right, guys, thank you very much. Okay, now we're talking about treating the foot itself when we talk to plantar fascia. Now here we're going to do, this is going to be a fascial approach, okay? And look, we have deep superficial muscles of the foot. Obviously we are covered with a certain amount of fascia along the underside of the foot that attaches on the rest of the gastrosoleus. As I mentioned to you beforehand, you have to treat this gastrosoleus. The tighter this gets, the more obviously it puts into the foot itself. From a fascial point of view, we've got our deep toe flexors that come down here, control the foot on heel strike and pronation. So we've got Tom, Dick and Harry, don't forget those. So tib post, extensor dig and then flexor on this side. Here I'm going to show you a little bit of a fascial technique that I've been using for years, which is an absolute ripper. Now, I've got the opposing leg here, but it's not going to be a problem, because what we're going to be doing is, instead of working longitudinally along this fascia, we're actually going to get a shear stress again, across, so more from a transverse point of view, okay? So I'm not going to be working down, I'm actually going to be working across, all right? Now, the reason for that is so I can create as much shear tension as I can, and working transversely across means I will get so much more shear tension on that. All right, so I'll put this leg away. Now, while we're doing this technique and talking about products, you need to be using the original for this. So this is more the sticky one. So if you've got too much cream on here that's too slippery, then you're not going to get that shear stress that you want. So it's only a little, like a minimal amount I'm going to put on here, and obviously it varies from person to person because everyone has a different sort of moisture content, I believe, with their skin. So you sort of have to sort of just test it. So put a little bit on to start with, and then the idea is just sort of a trial treat and see how much shear stress you can get on there. Okay, so the foot's going to be supported over your leg here. You'll be able to control the foot here. So the idea is that you're going to come in once again with this fleshy part of the elbow. Okay, so you sink into the tissue itself. So I'm going to come right to the outside here. Okay, and the idea is then foot goes into a little bit of plantar flexion, okay, and then we work across, all right? So we're working across the foot itself, creating as much shear stress as we can. That doesn't mean me going in as deep as I possibly can, all right? Please do not confuse shear stress to deep pressure, okay? So what I'm actually doing is I'm dragging the tissue as much as I can over this way, locking down and then working through that tissue there, okay? So I'm not trying to push my elbow as hard as I can into this tissue. It's the opposite. I'm actually dragging the tissue across, all right? So I'm going to work right across there like so, blend off. Do not bend your elbow and try and stick your elbow in there, because then you're defeating the purpose, okay? All right, and just watching that medial surface there. We will talk a little bit more about that abductor through there. And then we basically just work our way down the foot, okay? So it's really simple, just working across into the forefoot. Same approach, slow, don't try to rush through this, okay? And then we'll come up to the metatarsal heads. Just creating that shear stress. Now, you can do the opposite. So coming back from medial to lateral. So I went lateral to medial. Same process again, sink in, and then you tuck in, and then drag the tissue back towards you. Like so. How you going, Em?
Yeah, good.
Good. Same again, sink in and then drag back towards you like so, okay? So what I'm doing here is I'm going from medial to lateral. I started it from lateral to medial. Now, there is a little muscle that sits in here, okay, which is your abductor hallucis, okay, right in there, sort of one of those stabilizing support muscles for the medial arch. Now, it does have a nice little trigger point just in this area here, as does quadratus plantar as well. So these are two muscles that we can target from a trigger point of view. So if that's going to be the case, you will need to point off the elbow a little bit, So like so. So we're coming to the base of the calcaneal. So I'm going to push the tissue up. Then I'm going to sink down, rock backwards and forwards, and I should be on that quadratus plantar there. So once again, it's all about client's comfortability. Is that enough there, Em? Can you feel that? Okay. And then we can just sit on there. So once again, just enough that the client can handle this. And I may handle this in a sustained manner. Okay. So if they're struggling to sustain that pressure, you need to lighten off. Okay. So once again, just working along. And then you can then induce a shear stress to the rest of the plantar fascia, working down. And then you can come over to adductor, abductor, hallucis, in that medial arch, and just sit on that trigger point there. Now this one's going to be a little bit more bitey. So I'm just sitting there like that. How's that, Em? Can you feel it too much?
No, it's all good.
You sure?
Yeah.
You'll know, because usually you'll get a little bit of sweat starting to build up around the back of the heel or even into the foot. Okay, so if it's too much, that'll be their parasympathetics kicking in there. So just be aware. And then once again, you just sit here, just wait for it to soften, relax, and that trigger point just slightly dissolve away underneath. Okay, and then we can just do some really broad strokes through here. Once again, as I said, we're using our forearms, so we're not using our thumbs. How many people have busted their thumbs working feet over the years? And as they say, voila. Okay, so fascial shear technique, going from lateral to medial, medial to lateral, then longitudinal, quadratus plantar, and then our abductor hallucis. Thanks, guys. Okay, so this is an absolute must for treating plantar fascia, and that's the wonderful vacuum cupping. So it's probably the only time that we get to use a gun as therapists, but this is obviously a vacuum gun. So the idea is that we're talking about we create a vacuum, okay, in relation to decompressing the tissue around us. So what we're going to be doing here is going to be working along the length of the foot in a sliding fashion. Okay, so once again, what we're looking at is probably interfacing with that superficial fascia. So this is not necessarily a muscular type treatment. This is more of a fascial treatment. So we're going to be sliding along the length of the tissue underneath the foot itself. Okay, like so. Okay, it is a simple approach. I cannot take the credit for this technique. This technique was actually shown to me by a colleague of mine by the name of Dave Sheehan, who is a bit of an extraordinaire when it comes to vacuum cupping. And he definitely introduced me to this. And look, it's been an absolute godsend in terms of treating plantar fascia. So kudos for Dave for doing that. Okay, so in terms of application, we're going to be using the essentials. So we need quite a bit of slip with this technique, so you don't want to be using the original. So put a liberal amount through there. Basically, you're going to be covering the whole of the underside of the foot, all right? So get a really nice, broad spread of the cream, like so. Okay, then we come in. So we're going to attach just at the calcaneal attachment. So it will vary from person to person how much pressure you take. So I'm going to do 2 pumps for M. Okay, so the idea is that we've got here. So just a little bit of stretch at this point here, and what you're going to do is you're going to work longitudinally along the tissue, sliding, okay? And then back up, and then along. So we'll just take it up to the metatarsal heads and back. So we're just taking enough of that plantar fascia, and then you can slowly come back up onto the calcaneal, back down to the metatarsal heads, out to the lateral part, into the medial arch like so. Okay, and you'll slowly come out, and then you just reattach again with the gun. We go 2 again.
Now be mindful, if you get too much suction on this, they will not handle it. It'll be too much for them, so you'll need to back it off to what they can handle. All right. So we're just working along like so. And you can now you can also go transversely. Okay, so once again we're going for that shear stress transversely across. Okay. Yep. Comes off, reattach. 2. Same scenario again. Okay. So you don't need big movements because you can see the foot's not that wide. Start again at metatarsal heads. So you can just work through this tissue. I probably give myself about a good 3 to 4 minutes of doing this vacuum cupping, and alternate your longitudinal, your transverse, and actually obliquely across like so. And off it comes. All right, so that is vacuum cupping for plantar. So add that into your repertoire. So looking back, you've obviously got your deep toe flexors. Okay, that's to help that biomechanical component of the foot and predisposing to that stretching of the plantar fascia. And then we've got our fascial techniques. We've got those 2 muscles, quadratus plantar and abductor hallucis, and then you've got your fascial cupping. And then also you can add in some offloading, some rock tape as well. All right, guys, thanks for joining us. We'll see you next time.
So, if you even remotely enjoyed some of that content, please do me a favour and hit the like button below, just so that I know that you did enjoy it. Also, if you don't want to miss out on any of the content that we put up on a regular basis, then the best way to do that is obviously just to hit the subscribe button. So it's a bit of a no-brainer. But most importantly, if you really want to see the true show, the real show, take the opportunity, hit the link below, stuarthinds.com. That's where we have all the comprehensive assessment, treatment of a whole range of conditions. That's where we have our online courses and obviously our mentoring and so forth, the webinars and our podcasts. So if you're even remotely interested in what we do, go and check it out. Appreciate it. But also, most importantly, again, just be awesome at what you do.